Okay. Yes, and thanks everyone for joining. If you're not talking, please mute. It's going well so far, but I just want to remind you that that's always a good practice when we're on a joint call. And thanks for inviting me to this conversation. Let me introduce myself quickly. I'm Stijn Aelbers. I work for Internews as the Senior Humanitarian Advisor. I'm a former journalist from Belgium. I've worked around the world in many countries, in many different contexts, sometimes conflict, sometimes disaster, sometimes a little bit more peaceful, but then something like, Ebola happens or COVID-19, and that of course challenges a lot of the things that we do. And as a humanitarian advisor, I am of course focusing mostly on how can we help. I know that there's many aspects to the work of a journalist, and helping is maybe not the first one that you would think about, but that's my focus and that's my job. So a lot of what I would be talking about is really looking at that part of the job. Like, does it help? Does it really help? So I want to make that clear from the onset. As Internews, we're an NGO, we're working around the world on all the continents, and we try to support journalists and other people to create like what we call healthy information ecosystems, which means that like everybody who is receiving or producing information should be able to do that in a way that creates a diverse landscape that is inclusive, that everybody can be heard. But obviously also that is healthy in the sense that it's reliable, that it's factual. And we've all experienced, I think, before, but especially also with COVID-19, that there is a lot of noise and there is a lot of information out there that is not necessarily factual, that is not necessarily useful, and that adds to the noise, and the noise creates anxiety because people do not know anymore what they can believe, what they should believe. And they look mostly to people they trust, people that they think could have the answers, that are powerful in their community and in their country. And that position of power is very appealing because, they're strong people. They speak with a lot of confidence, and therefore it seems like they are the right people to follow. So what I think I would like to talk about today with you and all of you is to hear from you, like how you deal with that. Because it's not because I'm confident and it's not because I have power that I am an expert, that I know everything. And I would like to start by really asking that question. And it's something that I think we all have to do every day when we interview somebody. Is it an expert in that area? And that sounds obvious, but it's actually not so easy, right? Your Minister of Health might have a medical degree, but that might be as a dentist or in midwifery. That doesn't necessarily make somebody a virologist. But there is another question around that. That is like, even if that person has a medical degree, the job of a minister is not to cure people or to find a vaccine. The job of a politician is policies, is to declare certain measurements that will help the common good and to help the community, the country in going through this crisis, this health crisis, in the best possible way. It means that whenever you interview somebody, you have to probably ask two questions. What can this person talk about? Is that person informed about it? And two, is it person qualified to talk about, right? Like my doctor might be able to fix his own car, but he's not qualified to talk about that. He's a doctor as a profession, right? So those two questions, can this person answer my question? Does this person know what he or she is talking about? And is he or she qualified to talk about? Is that the role of this person in the community, in society, in your country? And I think those are good questions to ask every time you talk to somebody. It goes like, whether it's a politician, and I already gave an example about that, it also is the same for a religious leader. A religious leader has an important role to play in the community, and there is no contradiction between religion and science. There's no contradiction between the role of a religious leader in the community and a politician. Like, we need everybody. Everybody's involved and everybody can contribute. That doesn't mean that they always do. So you have to still ask the question, like, what is this person qualified to talk about? Will you ask the priest to fix your car? So if you wouldn't, would you trust the priest to fix your body? Like, that's a different thing. It's a different thing. That's a doctor's job, yeah? And so I think there is always, every time, like, you acknowledge, you understand the role of a person in the community and you ask questions about that role. The same is actually for a member of the community. Like, any person is allowed and should be allowed to talk about their concerns, their fears, the questions they have. Like, any person down the street should be able to voice their concerns and have a voice. Everybody does. It doesn't mean, and I think there's an important distinction to make. The person and everyone is a little bit afraid right now. Everybody's a little bit anxious because nobody fully understands what's going on. It's a new outbreak, it's a new virus, and quite frankly, nobody knows everything about this. Nobody, not even the smartest person in the world, right? But so that creates fears and concerns, and as a journalist, I think you have to take those serious. Every comment, every concern, every question from every member of the community is valid. However, and that's important, I think that doesn't mean that that person has based their fears on facts. It also doesn't mean that that person has the answer. Some people have an internet connection and think they have found the answer. That's not how it works. And that person that you interview down the street is not the person to tell what needs to be done. That person can talk about their own personal life, their own personal fears, and you can work with that as a journalist as something that makes you understand what people struggle with, what people want to know and need to know, and what they don't understand, the misunderstandings. And that's something as a journalist you can work with, right? So that's, in general, a very important question. Who are you talking to as a journalist, and what are they able to talk about, and what is the right question for the right person? And I think that would guide us through a lot of things in the work as a journalist. I think there's another point that you have to make as a journalist. We often hear it's the duty of the journalist to report everything. I would question that. I would question that a journalist has to report everything. If it rains outside, you don't just invite two people and one person says it rains and the other person says it doesn't. As a journalist, you have the duty to look outside and see whether it rains or not, to do your own research, to look for the facts. And if all the facts are leading to one conclusion, namely that it rains outside, there is no point in organizing a debate about it. You report on what you see outside, right? You report on the research you have done. So there is a very common format in journalism, which is we love debates. We love antagonism. We love battles between two politicians, between politicians and religious leaders, between religious leaders among themselves, between the strongest person in the village and, you know, the outsider. There's always this, the good and the bad, the black and the white. It's a very, very easy format to report, to put your work in. But there is no black and white. Nobody has all the answers. And quite frankly, I don't care who wins. I think we have to look at what is the best for the common good for your audience to understand to navigate their own lives, to make the best possible decisions. And I think if in a crisis, your role and as a journalist has become very important, as it always is, but you can add more confusion, more noise to all the information that people are receiving, and people, your audience, will disengage at some point. I can already tell that there is a fatigue, that people are sort of getting bored of it, that it's all about COVID-19. Like, it's your role as a journalist not to just keep adding noise to that, but to look at what is useful, what is actually contributing, also what is interesting. That's not just being a good humanitarian, if you like, it's also good journalism, to be more creative. Don't just report everything that comes out of the mouth of a politician. News is not just, it's only news when it comes out of the mouth of a politician. Like, try to understand what's going on in your community. Like, get away from the political bickery, day-to-day, like, you know, like games that they play on trying to get like the most credit for everything they do. So I think if I would go back to asking yourself, like, who are you interviewing? I think that's an important question. Like, I understand that in many of the countries that we work in, it's hard to resist your editor-in-chief. It's hard to not pay attention to what politicians say. That's the same everywhere, whether you're, you know, in Rwanda or in the US. Like, we're all fixated on those politicians, but journalism is more than that. And before you actually go to that press conference, you can actually ask yourself, like, what is it that really is the story, right? And what is it that I'm going to ask this person? Am I going to ask a politician whether there is a cure? No, like, the politician should talk about policies. So I think this is a little bit, once you're there, it's hard not to report on it. But maybe sometimes you can make decisions and discuss this with an editor-in-chief on other stories you can talk about, also to avoid that fatigue. Like, this virus, it comes with many different aspects. It has aspects of your social life. It has aspects on economical life. It has aspects on education and our children, like, going to school or not. There's so many different angles that are not just depending on a quote from a politician or a religious leader that you can think of, and that will also avoid people from getting bored with the stories that you bring. And therefore you avoid a little bit the power game, the being forced to report on those who have the loudest voice and the biggest microphones. So I'd like to end there, and I'm really interested in hearing from all of you examples of how you had to navigate, how you were forced or found a good solution of stories that you were bringing in a way that you could, you know, include all of the different aspects without having to become the megaphone for one particular perspective. So I'm curious in the rest of the conversation. I'll leave it here for now. Thank you.
Thank you very much. Dr. Menelas, the floor is yours.
Thank you very much for the invitation. My name is Dr. Menelas Nkeshimana from Rwanda. I work at one of the tertiary hospitals as the head of emergency department. And for COVID threat, I'm in charge of case management and infection control as a Sub-cell lead. So that's a bit of the introduction, and I'm very happy that the role of the media is being enhanced through this webinar. I would ask Christophe to share the screen. I have a set of slides that I wanted to use in order to facilitate this discussion. I call it an overview because COVID is still new for everyone, and there is no expert. As my colleague just said, there's no expert of COVID. It's only at the end when we will be able to compare our respective experience and see what we should learn. There's a lot to learn yet of today. So next slide. Next. So obviously we are dealing with a deadly disease, and that's why everyone is concerned, from Africa to Europe to Oceania. Everyone has to be concerned. It's not the first time that we are dealing with a deadly disease at the global level, but this reminds us that we should always keep in mind the past experiences. Each system should use this opportunity to look back and see what similar we have had in the past. And definitely we have seen even worse in the past. Next. It's a viral infection. It's not the first time that we have a virus that is ravaging the world. And as for any other new disease, it starts with no name, and they will call it novel. And since the family was known, this is the family of the coronaviruses, then you look deep, you realize that actually it's one of the 7th known to be a problem for human health. And of the 7, apart from COVID-19, you will see that we have, we could still remember SARS-CoV-1, this was 2003, and MERS in the Middle East Respiratory Syndrome coronavirus, which we knew also since 2012. So it's not the first time that this family of coronaviruses is causing problem to the human health. Another thing that we realized that the world tends to call viruses by the cities where they start from. So it was known in the literature as the Wuhan coronavirus. Some people would argue, would you call it by the city? This is so stigmatizing, and I would agree that there was no point to call it the Wuhan virus or the Chinese virus, because it's by the end of the day, it doesn't help you much. Then we call it SARS-CoV-2 because, again, it's a coronavirus, and it has some similarities with the coronaviruses SARS-CoV-1 of 2002. So they share some genetic material. And when we deal with viruses, to question an animal being the host, it's something that has been said since long ago. And the bats, we have always talked about the bats. We talked about the bats when we talked about Ebola as well. The reason is that bat being a mammal, and whatever a bat can have as a disease, it can be transmitted to a human as well. But of course, bats don't get sick to our knowledge. Next. The trouble with epidemics, they don't tell you, I will come tomorrow, have your health system be ready. No, you always get to know it after something bad has happened, and it's always a death. And you have seen that the journalists try to cover the news about this new disease presenting as pneumonia, right? Pneumonia is infection of the lung in the Wuhan city, and people will try to dismiss that because it has a lot of implication when you say that there is an outbreak somewhere. Everyone will start to be very defensive. Everyone will be, you're going to make some decisions out of fear. But these cases have existed. Some people truly had pneumonia in the Wuhan city. And you can even find, if not yet erased, you can still find the piece of news about the pneumonias in Wuhan. And when these deaths become many, or these patients become many, then the problem will blow, and it will be seen by everyone. And now you might consider to declare that you have a problem as a country. And once you have a disease that is new and you don't know yet what is the cause, the next question that you need to answer, like, how many people can be affected? It's what we call in medicine R0 or R0. Like one, it was believed at the beginning that if I have it and you can't find me, by the time you get to me, I would have infected 4 people. Then you understand that the magnitude of the problem at the very beginning. And the presentation, it can be asymptomatic as we know today. You can have some flu symptoms as you have seen today, but also a certain amount of people can have very severe disease and die from it. Next. Well, in 2003, when there was an outbreak of SARS-CoV-1, it was closely linked to this animal that we call civet cat, which was part of the delicacy. It was consumed as a delicacy in that place in China. And it's not the first time that our cultures or different cultures have different norms and culinary systems and beliefs. And this is not something that you can just tuck away in one day. And this tells you that whenever you find out that what you have been doing can cause harm to your health, it takes a while to change the practice. And if you know that from the beginning, then you are less likely to commit mistakes or to make wrong decisions that actually would make your problems even bigger. Then next, 2012, I talk about the Middle East Respiratory Syndrome. It was a coronavirus as well. The host this time was thought to be a dromedary camel. And apart from the cuteness of these animals, I think also most of you have enjoyed the milk from camels. They are quite delicious and expensive. Next. And now we talk about bats again. How come a bat's problem becomes a human problem? I told you this animal, this tiny animal is a mammal, as humans are mammals as well. So diseases, they are diseases that we can share very easily. And bats are known to have hosted a number of, being actually the host of a number of viruses. And we are yet to find out how many will be transmitted to the human. Then you will ask me, well, we don't need bats in the start. Why do we need bats? Why don't we go out and hunt all the bats? No, no, no. These tiny animals have a very great role in our comfort life as humans, because in French we call them insecticides naturels. As we sleep at night, these guys go out and hunt these small, small insects so that we wake up in almost insect-free human habitat. Then we cut the forest and now we have to move with us. Then I put this slide because the journalists, I think you have been facing a lot of questions, people comparing a country to one country. Why Zambia is not seeing the same number of deaths as Italy? Why Congo is different from the United States? So it has to go deep to the journalists should read deep and go into what we call sequencing of the virus, because the sequencing is closely related to severity of the disease that you might see. And you might have come up with terms like mutation, the virus has mutated, or the virus has changes its behavior. A journalist should be very confident to dissect all this information and address the public with it, so that it's easier for everyone to understand. So for COVID-19, we know it has been cut in pieces, if you can permit me to use that term. And we have S, G, and V clades. Clade is like a sort of subfamilies. And the one that you see in red in the G clade, it's supposed to be it has been seen as the most virulent. It's the one that Europe was having. Then again, you have to read more and find out what each country is having specifically. And allow yourself to say, we don't know yet. It's also a very valid answer, like we don't know yet, but we are looking into it using this and such methodology. Next. Animal to human, again, that's the first transmission, but today we are facing human to human transmission through respiratory droplet. Next. And this is a graphical to allow you to capture best how you can shower someone with droplets potentially carrying the virus just from speaking, sneezing, laughing, singing. And this will facilitate, you should use this kind of cartoons to communicate the people in a way that they understand, they are able to perceive and internalize. you are seeing that on the news, you are actually, the journalists are criticizing people who are wearing the mask just to cover the mouth and not the noise. This can be addressed through continued education and the science behind it. What are you trying to achieve, and what tool do you use? And if you stand a bit far, of course, as I speak to you and we face each other, I'm not going to shower you with the droplets that are potentially carrying the virus. Next. And this is one point that we wanted actually the media to have contributed, because I still call it a missed opportunity or a failure in the control of COVID, because if you remember very well, you will see that in the literature, there was a story that was coming from German saying that an asymptomatic patient, someone who has no symptoms, might have transmitted the coronavirus. And you could see that almost the entire global scientific committee was yelling at the researcher, like, that's not possible. Someone who has no symptoms cannot infect someone. So this is when you want someone in between, I always say that a journalist who stand in between and hear this version from A, hear that version from B, and have the two communicate in a healthy way. Because it took long for all of us to realize that nearly 50% of the people with no symptoms were transmitting the disease. And you can look back and tell how many decisions were wrongly made based on this fact that only the symptomatic can carry the disease. If we had had a healthy conversation at that right moment, I'm sure the problem would not have been magnified to this level. However, it's too late to go back and start pointing fingers. This is the conversation that we have after everyone has controlled or contained the disease. But for the future, we take this as a take-home message or an experience. In the future pandemic, it's not going to be the last one. COVID is not going to be the last one. In the future, when we handle epidemic and pandemic, everyone should play a role to advise and dissect and communicate the right information at the very beginning. Don't dismiss this because the minister has said that. Because the president said this, we all go for it. No, there's no such a thing. Someone should be in between, remain neutral, and hear both sides and dissect all the information and come up with a healthy decision. Next. This is the culinary practice that I was talking about. I once had dinner with my friend from Vietnam, and they served me with a liquor in the glass they have to put blood and the heart of a frog, and that was acceptable in Vietnam. Of course, I didn't drink it, or I drank a bit of it for the sake of diplomacy. But again, there are many things that are engraved in people's hundreds and hundreds years of culture and practice. And whenever you want to cut it because you have new evidence that it's no longer healthy, take enough time, talk about it, discuss, and achieve what you want to achieve. Don't think that the policeman will come and say that stop this in one day and you stop. No, that's not how you should negotiate cultural changes in any community in the world. Next. Then the symptoms, everyone know. If you are having symptoms, it's like another flu. We have all had the flu. But again, be careful. Now we know that 50% will not have this. But those who have will probably be much more highlighted and facilitated to access the test. Next. Next. As I said, it can be very serious. Don't look at the number of people who have no symptoms. Don't look at the number who have common flu, but look at the people who are at age of being much more vulnerable and have severe disease. COVID-19, as for SARS-CoV-1 in 2002, can just wipe out your lungs. And these are the people who are not surviving today. It could be an elderly, it could be a person with HIV, it could be a person who is struggling with cancer, it could be a person with diabetes. And I want each and everyone self-interrogate, interrogate yourself and realize around you how many people would be at risk of getting severe disease, and what are you going to do? What's your role as the journalist to make sure that they have the protection they need so that they don't get COVID-19? It could be your mayor, it could be the professor at the local university, it could be the chief nurse at your referral hospital, but self-interrogate and play a big role in protecting these people, because if you don't, the damage would be very devastating. Next. Next, again. Yeah, this is a wipe-out lung where you have to put the people on the patient on a machine to assist them in the breathing. And you can see most of the, especially in the low-income countries, we don't have these machines in all of our hospitals. If we had to get thousands severe cases, I'm sure it's a mortality in all of them, because we don't even have the basics to support them in good numbers. It's now that we are trying to catch up with opportunities that we have missed in the past. Next slide. Next slide. Yes. Now we talk about drugs. You have seen people prescribing out of fear. It's because they lack a mediator to reconcile the available experience, the available knowledge. Someone mentions chloroquine and everyone is on chloroquine and on toxic doses. I don't know if when you read articles about chloroquine, you go to read the side effect that you would cause if you don't carefully choose your weapon. These people, these studies that we are mentioning chloroquine, were in very mega doses, like 2 or 3 times the doses that we have used for malaria. And I'm not saying that studies should not happen, but the basic ethics should be followed. And I believe the majority of those studies have followed the ethical, have taken care of the ethical consideration. And we are going to try more drugs. You have heard about the president of Madagascar, His Excellency, President of Madagascar, communicating about that cocktail, the orange drink that is supposed to cure COVID. So in scientific, that's not the best scientific way to communicate a cure, because people might see the president and not the orange drink, and before you know it, everyone is drinking that recipe, even if, so you should take enough time, have science inform your decision. You should take enough time, months, years, but come up with something that you have a strong evidence that it works. What's going to be the problem with that orange recipe, if I had to guess? One, the base of that drug is anti-malarial, and I don't know how much malaria is a problem for Madagascar, but for countries that still have malaria as a problem, you don't want to put your weapons like that with no scientific evidence. The same goes for vaccine. Usually when you have a new disease, it takes you at least 2 years before you come up with a vaccine. So there is a process to reach a cure. There is a process to study a drug. There is a process to reach to a vaccine. And ask yourself, how long have we been waiting for the malaria vaccine? I have lost track in time. I think it's very, 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 very long. So that's how you should be careful whenever you come up with something that you can put into someone. If it doesn't kill him, it might do nothing or create unforeseen consequences. Next. Wearing mask. We know that mask is now a policy in the majority of countries, and this came up with supporting science behind. Next. Next. A crisis is also an opportunity. It's not the first time that we face a pandemic. It's not the first time, that it's not going to be the last time that we face a global pandemic like COVID. This is an opportunity for each individual country, individual organs, the media, the medical personnel, the army, the police, the scientists, to take this opportunity and debug whatever they could see that it was not strong enough to address COVID-19 magnitude. And this will enable us to face the future pandemic of this magnitude. As I said, the global health now highlight that 70% or more than 70% of emerging diseases are going to be of viral etiology, including the viruses that we have seen in the past, polio, this and that. They will come back, and with stronger virulence than we have seen before, and we will face also new diseases, new viruses that we are not yet aware of today. Next. And speaking of opportunity, crisis and opportunity, if you look at at what China did in 2002 with SARS-CoV-1 and what was the response for SARS-CoV-2, it shows you that these people learned a lesson. In SARS-CoV-1 2002, it took them months, almost 6 months, to come up with the virus, to identify the virus. But if you look at COVID-19, it took them, by December, they declared the first case. In January, they had sequenced the viruses. And once you have a sequence of the virus, you can now have drugs to try. You can have severity to assess. And you can also ease the communication. You can imagine how it would be a disaster if we had to wait up to now and we face the people, the population. Actually, we don't face. The journalists will face the population, explain why people are dying, and we don't know what is killing them. So the sooner you knew the name and the sequence, I believe the easier it was for you to address and to facilitate the conversation as well. Next. This is a tragic opportunity, and the media should play a role. Everyone should have everyone realize that this is another opportunity not to miss. We should revisit the way we interact with our environment, the way we interact with our animal health. If we mess up one of the three, then problems will always come back to us, either we want it or not. Next. The impact on health is self-explanatory. There were a lot of human losses. There are a lot of psychological distress. The patients that we treat today, the majority of them will have an acute stress reactions. The stress will go to their families as well, their community. This is one of the most devastating situations. Next. The impact on the economy. Even if we had to say that COVID-19 stops today, I'm sure we're going to handle the economical consequences for the next 5 and 10 years. And who knows, it could even be longer. Next. Our politicians are stressed. Tomorrow they will be stressed, and the future will be stressed. And I know when journalists have to speak to a stressed politician, it's not always easy. It always ends bad. You will see asymmetry, and someone said that because I'm a minister, I want you to do this. So the stress, but you should see how do you speak to someone who is stressed and get what is favorable for everyone. I know you are best in doing that. You don't really get down because a minister or a senator has said that. You should be able to reciprocate as long as you have the supporting science behind you, supporting you, and use it to make a point. Next. Next slide. This is a global situation. It started as a Wuhan problem. That's how the media covered it. But now we know that it's a global problem. And we still have opportunity to correct ourselves. Now that we know that it's a global problem, let's come up with strategies that are not bound to countries, like a Zambian strategy or an Egyptian strategy, American strategy. We need to have a block, a regional strategy, a continental strategy, and a global strategy. We should think collectively, not individually. We are in the same hot soup. Was this pandemic preventable? There was a bit of mention of it on the media, but again, this is not the kind of discussion we would want to have today while people are still struggling with containment of a disease. But once the pandemic is over, we have to keep track with this and see what we have done bad, who should have said this on time, who should have done this, and where should we have improved, and find a nicer way, a diplomatic way to put it on the table, and we use it for future pandemics. We use it for 2023, 2050, 2063. So this is something that should be very well documented. This is it's almost everywhere the same. Like you activate your rapid response team, you set up hotline, then you interest your population to comply with you. Next. Next. Then you do the training. Before COVID actually came to Rwanda, before we declared the first cases, the first case in Rwanda, we had the time to prepare. As we are seeing it's moving from Asia to Europe, we have already started training in Rwanda. And that is, that's the role of epidemic intelligence. Everyone should stay away. Not all of us should be asleep when we hear that the country in the remote environment is facing a problem. We should be interested because, and ask ourselves, can it reach to us? If it's yes, then you better prepare as if it was already at your doorsteps. Then the contact tracing requires a lot of manpower. It's a day and night, a very intensive work. Next. Then some people had to, they have enough PPEs, personal protective equipment, some did not have, but again, there should be a global share of the burden, and the response should be equitable. Because if you don't respond equitably, you might contain a disease in a given territory, then you still have to address your neighbor's problem as well. That's why I think we should facilitate a collaborative approach. Next. Then most countries, they prefer reading, some prefer following the radio, some prefer having some sketch. Use whatever you think your population is able to accommodate and able to understand better. Use graphics, use words, use TV, use their preferred singer, whatever you think it's locally relevant and context specific, because by the end of the day you have goals to achieve. Next. Again, the role of the media, unfortunately you have to be at both sides. You should participate, actively participate in all decisions that are made at the country, continental and global level. You should not stay and wait for the resolution. You should be part of the meetings to start with. What are we going to achieve? What is the nature of this disease? What do you want the people to do with? And you inform and you dissect together and you come up with the resolution together that the Zambians are able to accept, that the Rwandans are able to accept, that the Americans are able to accept. And the media people, the journalists, you should also read yourself the science. Don't just swallow whatever your Minister of the Health tells you. Read it for yourself, line by line, articles by articles, and see if you come up with the conclusion, the same understanding or the conclusion with your minister. If you think it is not matching, then ask questions. Say, excuse me, Minister, I saw this, and he said that. Why did it change? So you should be able to analyze and have a degree of doubt and cross-check all the information yourself, because the science out there is open to everyone for reading, and you should be the facilitator of a regional approach, continental approach, and the global approach. So don't let your countries adopt this territorial or district strategy. This is a global problem. And remember to be also on the side of the people. Listen to their stories. Listen to their cultural belief, the religious belief. Meet the pastor who declare he can cure the disease. Have a scientific conversation with him and challenge him. Tell him that what he's doing is very wrong. You can't cure it because this is the causative, this is how it is controlled, this is the problem that is caused. And have a healthy conversation with all the people who might actually mislead the population when you are absent. When you are present, it's less likely to happen, but when you are silent, someone will jump in and twist the whole thing in the wrong direction. Next. I believe the last slide, the response is collaborative. We can only win if we work together. Everyone plays a role. We should have and promote a healthy conversation. Thank you very much.
Thank you very much, Doctor. Thank you for a very interesting and very helpful presentation. I think now we can have time to open the floor to participants to ask questions, to give interventions, to share their experiences. Yeah, I think Anne has sent the question. If she is still online, you can ask the question. Anne? Can you hear us, Anne? Just if you have a question, remember to press on raise hand, then we give you the floor. Annie, go ahead.
Yeah, I was asking. Hello.
Yes, we can hear you.
You can hear me. I was asking about the religious organizations that claim to work with all manner of diseases. How do we handle them issue?
Yeah, we don't hear you well. Could you repeat? So, as you have sent it before, I can lead the question for you. I think there's no problem. Okay, you said that some religious leaders claim to pray and heal their faithful, yet they haven't healed the coronavirus patients. How would one report that without offending the faithfuls on this emotive topic? I think the question is that. So, Stijn, can you say something on the question?
Yeah, but I would like to hear from other people as well.
Exactly.
Some thoughts on it.
Yeah, but can you respond? How can you report them without harming them?
Yes. So I know that that's a tough one, but I think as a journalist, you can always ask the same questions. And that is, one is maybe also not to put everything in the same bag. There is thousands and thousands of people who are nuns, who are nurses, working on the front line, working very hard, using medical science to help people. There's thousands and thousands of hospitals, hundreds and hundreds of hospitals across the continent, run by religious people who are using medical science to help people. They're putting their own lives at risk by treating patients day in, day out. And they are often like of the same, maybe religious, of the same religion as people who claim to have a cure or claim to can cure people by not putting their own lives at risk. I do think you have a duty to stay critical without disrespecting a whole belief or even the belief that these people have. Proof is something more than having a case, and proof is something more than somebody who claims something. I can claim that I can cure people, and that doesn't mean that you have to believe me as a journalist. Like, I can claim that 2 people have walked away healthy, but that doesn't mean it's true. A few people might have walked away feeling better than that they did before, because a lot of things help. Like, for instance, belief in health, and the belief that I can cure can make me feel better. It doesn't mean it works. It doesn't mean that I can repeat that. It doesn't mean that it's a guarantee. It means that it helps me. Like, calling my mother helps me to feel better. There's a lot of things that help. It doesn't mean that it works, right? And so you have to stay critical. And that's why I said in the beginning, like, people have different roles. Religious people, religious leaders have a role in the society, but it's a different role from a doctor. And I think there's thousands and thousands of people who understand this, who are working really hard with the available science and with the available medical tools and approaches, that know very well that you can combine those two. They don't have to be at odds with each other. So I think you have to still, even if that person says, I've cured somebody, why would you believe that if I tell you I fixed your car, you want to check whether your car is fixed? You don't have the obligation to believe somebody just by their words, because they're in a position of power, because they have respect in the society. You still need to check whether it's proof or not. And if that car is not fixed, then I can say whatever I want, but the car is not fixed. But I'm happy to hear other people's thoughts on that.
Thank you very much. The next question goes to Violet. Violet, can you hear us now?
Yes, I can.
The floor is yours.
Okay, are you able to get me?
Yes, we hear you.
Okay. You see, in Zambia, there is some tension just after the announcement by the Minister of Information that she tested positive to COVID-19. Because Zambia next year will be going forward, people feel it's just party, gain sympathy from the public by the announcement by the Minister of Information that she tested positive for COVID-19. In this situation, as a journalist, how do you handle such a situation where their opposition are coming out and saying they need the Minister of Information to be tested independently of the Ministry of Health? They need independent people to conduct a test on her. As a journalist, how do you take such a story?
Thank you. Dr. Menelas.
Thank you very much. That's very interesting because it tells you how COVID can be, like the status of COVID can be utilized. Some perceive it as a fearful disease. Some might perceive it as an opportunity. And I think you should keep it centralized. If in Zambia you have a mechanism that is known to be the channel for testing for COVID, I think you should not go out of that. Second, I don't know how you would handle the privacy of the information. Like, why would you want someone test someone else and bring you back the results? Why the results and the status belongs to that minister. She owns her status of COVID-19, positive or negative. It does not belong to the opposition. But if you sense that he or she can use it in a way that is beyond the personal interest, then you should see how to react to that. That's how I would go around it. Like in Rwanda, we have all the COVID-19 tests are done by the National Laboratory of Reference. They are not run by each and every clinic, private or it is centralized. The channel is very well designed, and the results can be verified. So I hope it's the same for Zambia as well.
Thank you very much, Doctor. The next question goes to Pierre Creva Nyonguru. Can you hear us? Unmute yourself.
Sorry.
Okay.
Now you can hear me?
Yes, we can, very clearly.
Okay. Okay, thank you very much for this session, but I still have one question. Why Africa is not affected at the same level of Europe and now USA? Is there any scientific reason behind this? Thank you very much.
Thank you. Dr. Menelas?
I'm sure, I was very sure that question will come up. And honestly, we don't know yet. But there are several hypotheses that are to be tried. Some scientists are grouping up, are meeting in groups to see if they can set up a collaborative project to explain that. And this we do is comparing the genetic material of the viruses that have been isolated in our countries, thinking again that the virus has mutated. The virus has mutated, the weather conditions, the climate might have affected the virulence. Those are hypotheses yet to be studied and presented and criticized. We used to think, I don't know how, most of the countries in Africa have, the majority of cases are imported. Like you might have someone traveling from Europe to Lesotho. You would assume the same virus acquired in Europe would keep the same virulence once the patient is being seen in Lesotho. Why the difference? Again, it's the same hypothesis, like the mutations, the weather conditions, it is in the same. But for now, you should say, we don't know yet. We don't know yet. Scientists are looking into that.
Thank you very much. If you have a question, please press on raise hand or write in chat. We can take 2 more questions. Someone is asking here, Yuri, you have a question. Can you please unmute yourself and speak out? Uri?
That's a surprise now. I thought there were many questions and you have to answer the written questions then yourself. I just wanted to get, everybody has got it in writing. My question is, you know, we have heard this nice scientific reasoning and what our expert has said, but we're talking today about religions and about superstitions, about what people want to believe. And isn't it hard to convince them of what is reasonable to believe? Isn't it hard to convince them that the world is more complicated than they want to think? And how do we do it as a media? That is my question. Have you heard me?
Yes, thank you. Thank you very much.
Okay.
Stijn, can you comment on that?
Sure, and of course that is the heart of the matter, and it's what we're actually talking about here today. And there is no easy answer. With Internews, we've been working, you know, for many years around misinformation, rumors, misconception, and often also, you know, like that involves a lot of beliefs that are there. If anything, I would say, like, it's not enough to have the facts. That's for me clear. Like, you can have all the science in the world and all the facts in the world. Like, you can throw them in you know, in beautiful videos, in posters, in audio, in whatever format. As long as people don't feel acknowledged, and to me, that is the key word. You have to acknowledge people, but you also have to do your job. as, you know, somebody who works in information communication or a journalist, to organize your facts, to organize your information, which means to me that everything that you do should start by first understanding very well the situation that people are in, the questions they have, the hurdles that they face. I always take everybody very serious when they are afraid of things, when they are trying to do something. We've already seen in the COVID-19 response, people going around with warm water with salt and a spoon and maybe some lemon and maybe some ginger and maybe some, and to me, that doesn't speak so much of the wrong belief system as much as it actually tells me that people are desperate for some level of control, for something that they can do. So rather than just dismissing people and saying that doesn't help or you're wrong to believe something, you actually can use that to say, you want to do something, you want to help your neighbor, you want to keep your family safe. Here are things that you can do. If there is, you know, fear from the hand sanitizers, as we've heard, like I don't remember where exactly it was, but was it in Mozambique, or where people thought that it could explode, that it was so dangerous that it could explode, then you have to talk about that. But the point is not you're wrong. The point is, like, I've heard you, I understand, but this is what a hand sanitizer can do. And yes, maybe it's new and maybe it's different from the soap that you're used to, but actually this is what it's good for. And also maybe this is what it's bad for. I wouldn't drink it if I were you. So as much as there is no silver bullet for this, I don't think going into a wrong or right, I don't think that using a pure fact-checking methodology, right? Like we fact-check what people say, we fact-check the president, we fact-check, that's not going to convince me that you're actually understanding my situation. And I do think that that's the start of everything. If you acknowledge people and the struggles they have, like you can talk about social distancing, and that's like a scientific good approach. But in reality, if I live with my extended family in a small room, like you can have all the facts in the world that that's a good thing to do. It's not going to happen. If I work in a canteen in Nairobi and, you know, like I need that income and it's a very busy canteen and my boss doesn't close it and like forces me to go to work, like you can have all the facts in the world about what is good and what is bad scientifically, but like I want to keep my job. And I think people are actually always, nearly always, looking out after their own situation and trying to make the best possible decisions. Sometimes ill-informed, to be honest. Sometimes basing it on the wrong advice from people who claim to have all the answers but don't. And I do think, like, keeping that in mind and taking it serious and working with people. I've worked a lot with community leaders, including religious leaders around the world. And they're under a lot of pressure. Like they have a status in the community, people come to them for answers. And they actually are forced to give something. They will have a hard time admitting that they don't know, right? Because that will harm their status. So the best thing to do is to work with them and make sure that they have access to reliable information. So there's a number of things that you can do, but it starts with acknowledging that people, you know, like that people have their own reality and that they're trying to make decisions that keep themselves and their families safe, ultimately. But it's a lot of
thank you very much. Stijn, thank you very much. Let us take another contribution from Rafiki, a question from Rafiki. Then after Rafiki, we are hearing about we are receiving El Kuebo of our colleague in Nigeria. I think he has an experience to share with us. Rafiki, can you hear us now? Go ahead.
Do you hear me?
Yeah, sure.
Okay, I have, yes, I have one question. You see that about this pandemic, there's some country which closed their activities when they are in the lockdown, but other countries they was not closed their activities, and they not give us new true numbers of affected persons. I ask is if there is no question or no problem about it here in Africa or in Rwanda to be affected and to decrease some numbers of affected of persons with COVID-19. Thank you.
Thank you, Rafiki. Dr. Menelas, can you hear?
Yes, I can hear that when it comes to share numbers, people don't have the same understanding about it. And you always feel like if I share a dizzying number, everyone will point fingers, they will start blaming me that I have become a problem to the region. And these are the things that we need to avoid. And I would relocate that role to the role of diplomacy in handling sharing data in terms of pandemic. So I don't have any clear number, but I believe transparency in the response should be a common value.
Hello, Dr. Menelas, we cannot hear you. I want to bring Toro on the floor. Can you comment on Rafik's question?
I think I second Dr. Nkeshimana. You know, now it's up to the sources now. You know, it's all about the sources now. We are having a lot of countries have had very stringent laws and policies in place, and we're seeing a number of journalists having been hauled to court because of violating a number of issues which have been laid down. So I think making sure you follow the laid down procedures and capturing the figures given by the verified legitimate sources.
Thank you very much. Let us lastly, but not leastly, hear Abdullah. Can you hear us, Abdullah? Can you please unmute yourself? Oh, maybe there is technical issues. Okay, then after, as you are closing, Dr. Menelas, if you are back, can have the floor, then we close.
Yeah, thank you very much. Hello? For the very.
Okay, Menelas, sorry, Abdullah is coming. Let's listen his experience.
Hello.
Hello.
Yeah. My name is Abdullah El Kurebe in Nigeria. I am a journalist and editor of News Diary Online. Can you hear me? Hello?
Yeah, we can hear you clearly. Hello? Hello?
Hello? Hello? Hello? Hello?
Yes, Abdullah, we can hear you.
Okay. Yeah. I am a survivor of COVID-19, and the experience I have is one, generally, most people's perception about COVID especially in the rural areas, is that it is actually non-existent, that people, especially in government, are trying to make money out of it, and that this is disastrous, including that some journalists too don't believe that it exists, would not even be ready to, for example, when I was informed that I tested positive as a journalist because a colleague died of it, and that colleague I knew I had contact with, and I was informed I was tested positive, so I was in the isolation center for 10 days. And what I can say about government's response to COVID-19 in Nigeria depends on region or county or states. Some states actually try to see that they contain the spread of it, while others, contact tracing is actually faulty, because like in my case, until I was out of the isolation center 10 days after, before I was contacted to name my contacts, those I had contact with before I was in the isolation center. That I think is faulty, because it increased community transmission, because those I had contact with also in turn had contact with others, so much that these contacts could hardly be traced and got into isolation center or quarantined. Again, some isolation centers are not as favorable as should be for patients, COVID patients, because in situations where if you have cases of patients running away from isolation centers, it is as a result of uncomfortable conditions, including poor feeding arrangement, probably in some cases, poor medication. For example, I published a story yesterday from one of the states in northern Nigeria, where the reporter was narrating a situation where a patient, since he was taken there for good 14 days, was not given any drug at all. So this is a serious situation, and it clearly means for such patients, there was no such COVID on him. He was not, it means he was not tested positive because he was not given any drug for 2 weeks. And he was discharged without taking any drugs because he was not given any. So these are such situations in certain countries in Africa where governments are not serious about it. Some governments are alleged to be receiving money from donors, including federal government, only to squander such on other things other than fighting 19. This is why one of the states in Nigeria, Kogi State, for example, the governor refused for any official of NCDC, that is Nigeria Center for Disease Control, to go to the state for anything COVID. And so
you
far,
have a minute, Abdallah. You have 1 minute. 1 minute remain.
1 minute. Okay. So on a general note, where the stories are is actually in Nigeria. If all journalists in the world could gather in Nigeria, they will have stories to tell differently from other countries. And again, this meeting should find a way of actually educating journalists, especially those who do not believe that in science you can find solutions. This is a big problem in Nigeria. This is not excluding the fact that, except for the few science journalists we have, most others, especially who have not been on health beat, have been struggling to see how they can report COVID, including some other health issues. Thank you.
Thank you very much. So we are closing. Just Dr. Menelas, just 30 seconds, your advice to the media.
Collaboration at both sides, at the decision maker side and the population side. You should find a way that you facilitate the conversation to go to leaders towards the goals that you want to achieve as nations, regions, a continent, and beyond.
Thank you very much. Thank you, Dr. Menelas Nkeshimana. Thank you, Stijn. Thank you, all participants. Oh, thank you for accepting additional 26 minutes. I wish you a good day. Thank you.